So, as Benette would say, Gillian Saloojee is one of my tribe. She's a pediatric physiotherapist who's been working for many years in the field of childhood disability, but particularly cerebral palsy, and she's currently the executive director of Malamulele Onward, and she can tell you all about what they do with Malamulele Onward. So I'm going to hand over to Gillian to tell us and to finish off the presentation session for this morning.
So the last presentation of the conference, so congratulations to all of you for your staying power. I hope that the pictures will keep you awake and interested. In some ways, I don't really have anything to say. I think the previous speakers have all alluded to the fact that how various NGOs have helped them in their work, and I really thank Chris Sutton for his comments about the value add. And I think in a nutshell, that's probably what NGOs do, whether they're helping the case coordinator in the Downs Syndrome Clinic or the Allergy Foundation. I think it almost in a way speaks to itself what is the role of an NGO. So just to unpack that a little bit, what I'm going to cover here is who are we talking about, and perhaps just give you a little bit of insight into being part of an NGO. Having worked in the health service for 20 years, I then have now gone across into the NPO sector. And then this morning you heard about the 5 C's. Well, I'm going to talk about the 3 P's. And then I think what's most useful is to actually say how, as an NPO, use that as a practical example of what we do that maybe has helped answer some of the questions that we have. So this slide is self-evident. This is what we've been hearing about for this last session. I'd just like to highlight that children with long-term health conditions is often the complexity, and I think that was one of the things that Tony said this morning. And then following on from that, using the ICF, what the children have in common, at a community level, you can't talk about different diagnoses, it doesn't make sense, whereas if you have a more functional approach, because if you're having a look at your management and what you're going to do, what all the children have in common is that they've got some limitations, either in functional limitations, in what they can do, in activities, or in participation. So that for me is the foundation of any intervention that you're going to do. What you've heard throughout this conference as well, and I would say more especially with children with long-term conditions and disability, in that what are we lacking? We don't know how many there are, we don't know where they are, and we don't know what their needs are. We've spoken about access to services. What do we mean by access? What do we mean by services? And how effective are they? So I can skip through that. What's in a name? I don't know whether you've ever asked yourself that question. What's the difference between an NPO, an NGO, a CBO, a community-based organization, community service organization, a grassroots organization, a parent organization, a foundation? Basically, there's no agreed terminology. What they all have in common is that they are not. What are they not? They're not part of government, and they're not there for profit. I think that's what they all have in common. So what then is the value of an NPO? And NPOs have different purposes. Whether you service, whether you offering or helping to implement a service, which I would probably say is the majority of NPOs. And within that, you must also think of places like ECD centers, daycare centers. So at that service level, or as an implementing partner in the delivery of healthcare service. Then you also get NPOs that are advocates, and they form a really important part of children's disability organizations. It's the parents and the advocates that will agitate for change. Some NPOs focus on research, and I think what all NPOs can offer is their experience can play an important role in the formation of a health policy. So I think they're an important partner in that. What's the advantage of an NPO? I think usually there are people that are obsessed about their particular cause that they are doing. So they don't know anything else, but they know a lot about one particular area. And I think with that, there's a lot of passion, there's a lot of enthusiasm, which is quite a different environment to working in a government sector often, where you're paid to do a job. Here, you're in an NPO, certainly not for the money, but you're in it because you really want to do it. So I think there's a different drive behind it. So there's an energy that an NPO has with them. Often they may give a more human face to a particular problem, challenge, condition. I think NPOs offer a lot of expertise and experience, whether you've got the Down Syndrome Autism Association, the Hemophiliac Foundation. They are experts in one particular field. They offer a lot of flexibility. We are not bound by a lot of bureaucracy, particularly if you're in a small NPO. And often the more grassroots and community-based organizations offer you greater community involvement. However, there are many disadvantages. Number one, number two, number three being funding. And then the nature of an NPO can mean that it could be, particularly the smaller ones, that there could be over-dependency on a particular founder or leader, which then makes a problem with the sustainability of an organization. What happens when that person leaves or that person goes? And that makes sustainability of the organization quite a challenge as well. Because you're passionate does not necessarily mean you know how to run an organization. So you can certainly ask me. You have to, running a non-profit organization is basically running a business. There's no difference, except you're not working for profit, you're working more for some sort of social benefit. But at the end of the day, you still have to run a business, particularly if you're going to survive. You do have a lot of NPOs that maybe fly by night, a problem of legitimacy and regulation, problems of transparency and accountability, and also if services are not coordinated, maybe ineffective. And what I said, the last point here is about coverage. Small organizations, you've got made you great, but it's very limited to a particular area. So this is in my experience of working with an NPO is, I think I've been able to tell you what the role is, what are the advantages and disadvantages. But for me, if we want to look at long-term sustainability, my 3 Ps are parents, partnerships, and participation. That, for me, parents are the absolute powerhouse in terms of the work that Malamulele does in working with children with a particular condition, which is cerebral palsy. And I think in any long-term health condition, it's the person living with it and the family that really kind of take the ultimate responsibility. So any program, any intervention has to have parents at the absolute forefront of what you're doing. And then it's partnerships, which we've spoken about already today, partnerships and collaboration. And the partnership I've suggested here is with the NPO, with the government, which by that I mean probably your health services, and then with your funders. And then participation. And why I say participation, what is the purpose of our intervention with any child with a long-term health condition? And it's about that child being part of, being included. And I think of the talk that we've just had with Angel, that she was part of, she could be included in a school environment, in recreation. So I think we must never lose sight of what our work is with children with long-term health conditions. How do we make it possible for them to participate, to be part of? And here's just a small example of a young lady with cerebral palsy. She's actually 29 years old. And she's from quite a remote area near Crichton. And one of the things we do is provide therapy. And there she is, and I thought, it's 29, what does a 29-year-old want to do? They want to look like a lady, you know. So there she was with us, and what she had to learn to do was put on her cream every day, do her face, and do some more activities for herself in terms of self-care. And the difference that gave her just in terms of dignity and how her family perceived her, that she's not, you know, someone that's just got this disability, but she's a person. She's a young woman, and we need to see her as a young woman. Okay. And that I think what all our intervention is about is, no matter how disabled a child is that child part of the family? So those were my 3 Ps, the parents and the partnership and the participation. So I would like to just end with an illustration of one of the projects that we've done with Malamulele Onward. We're a non-profit organization, very proudly 10 years old this year. And what we do is we exist to enable each child with cerebral palsy. So we focused on a particular disability. Why that one? Because it's the most difficult, the most complex to deal with, and it kind of never goes away. It's for life. And we focus specifically in rural areas because that's where the access to the care, I think, is hardest for children with these kind of complex needs. So that's what we do. So one of our projects that we did, which I'm going to tell you about, is in Nutu. Now, what's common is that we don't know the numbers. How many children are there of any kind of health condition? How many kids are there with CP? So what we actually, our project here was to initially start off with saying, well, how many children are there? And it's basically a situation analysis. So how did we do it? Using parents. It was a community-based prevalence study. It's still ongoing, using snowball sampling. And the technology that we used is a cloud-based data management system, open data kit. It's free software, and you can just then write your own program, and all you need then is a tablet. So what have we found? Well, we have found 240 children in one district municipality, and that's taken the course of a year. So it's done by parents, visiting other parents, hearing if they know of other children in the area. And what we have discovered then is that 81% of children aged 7 years or older are not at school. Only half of the children are currently attending therapy. Most of them are getting grants. Only more than 2/3 of them need a device. And we've been able to map them. So that's what this particular software can do. You now have a map. You've got GPS coordinates of where every child in that area is. And you can obviously add to this. You can put the resources in. Well, where's the ECD center? Where's the clinic? So any of that can be mapped with this app. But now you've actually got information about it. Of the children where we knew the HIV status, remember this is purely community-based, done by parents, shoestring budget, only looking with taking out information from the Road to Health card. So if you want to know how effective they work, well, of the 240 children, of the 127, so just less than half, the HIV status were recorded. 10% were positive, 20% of the mothers were positive, 23% of children who were fitting were not on medication. So if you want to know what your district support services are doing, as I say, someone that's working at a kind of grassroots level, it's one of my biggest frustrations is just basic medical care. Okay, how does this help us? What does it mean? So we've got some baseline data. That's what we've got. We know where the gaps are. I put that picture up there. Teenagers is another story on its own. And we know something about the resources that are available. So what is our plan? Our plan is to fill in the gaps. That's, I think, our role as an NPO, the kind of value add. How do we fill in the gaps and complement existing services? How are we going to do that? Training, and not just training, but mentoring as well. And what is the vehicle that we're going to use are the parents. The parents are the powerhouses. What are the parents going to do? They're going to assist the health services. By giving the parents knowledge, they are going to assist in running CP clinics, good quality, effective CP clinics. They are going to be available to do home visits. They are going to be available to facilitate inclusion. They are going to be the advocates. So that's our plan, which we are currently implementing. But of course, who's going to fund that? That's the challenge that an NPO has. So in conclusion, I'd just like to thank you for your time and for your attention.